Chris Fox is the executive director of the newly formed Voices for Non-Opioid Choices Coalition, Voices. It's a nonpartisan coalition dedicated to preventing opioid addiction in America by increasing access to and utilization of non-opioid approaches to managing acute pain. He's a seasoned veteran in Washington, D.C., boasting over 15 years of experience, including in managing public health campaigns. And prior to work at Voices, Mr. Fox has also spearheaded public health advocacy campaigns addressing the U.S. obesity epidemic, kidney disease, and critical care. Chris Fox joins us this morning here on WSBA. Good morning, Chris. How are you?
Good morning. I'm good, thanks. How are you?
Well, I'm good. Non-opioid pain relievers. Talk a little bit about that, because a lot of people are trying to cut back on prescriptions. Doctors are trying to cut back on that kind of thing. What's going on here?
Yeah, so, and first of all, no apology necessary. You know, it happens, and we're nothing if we're not flexible in today's day and age. So, first of all, non-opioid choices. And so what we mean by non-opioids is it might come as a surprise. There are a wide array of, say, FDA-approved and other therapeutic services that have been deemed to be safe and effective in helping patients deal with their pain. And so when we talk about non-opioid choices, we're talking about things like acetaminophen, ibuprofen, pain pump devices. We're talking about therapeutic services like chiropractic services,
right,
physical therapy, acupuncture, things like that. All of these types of approaches have been deemed to be effective in doing what we know that they can do, right, which is help provide effective pain relief while also minimizing unnecessary levels of exposure to opioids and in the process reducing opioid consumption.
What about the reaction so far of the medical community on cutting back on the amount of pain medicine they're giving to people after various operations? I mean, obviously that's had an effect as well, right? But maybe not the total effect that you'd like to have in the long run. Your thoughts?
You know, I think we have not gotten a whole lot of feedback or negative feedback on our approach. I want to say, you know, something first and foremost, which is that at Voices, we're not against opioids in any way, shape, or form.
Mm-hmm.
What we are for is referred patient and provider choices. We think there should be choices for patients and providers in how they manage their pain, particularly after a surgical procedure. And so we say, let's not just default to the status quo, which is all too often opioids. Let's have a conversation between a provider and a patient, and let's see what that patient wants to do. Does that provider want to use what we call multimodal approaches, which utilize a wide array of different types of pain approaches to help that patient and in the process minimize exposure to opioids? Does the patient want to try, you know, psychological services or chiropractic services or physical therapy? Whatever the case, we think there should be choice. There's choice in a lot of different decisions we make regarding our healthcare. Unfortunately, for how we deal with our pain, the decision is all too often made for us by the fact that non-opioids are not necessarily always available to patients and providers.
Right.
And so what we do is we advance policies to make them more available.
Now, I would imagine there's a lot of education that's going on, not only with people who are going to hospitals so they have some idea of the choices they may have, but also of the providers who are providing various things. And rather than just go right to the opioids saying, okay, well, now here's an array of things, because that has not always been the case. So I would imagine your job is very tough out there, out in that community, making sure that you're trying to provide alternative kinds of sources. Would that be a fair statement?
Yeah, I think that's exactly fair. You know, I think what we have heard, and I'm not a doctor myself, although I speak to them almost on a daily basis, but what we hear is that doctors often prescribe opioids because that's what they're trained to do. They're trained to treat pain with opioids, and so it's hardly their fault that that's how, you know,
sure,
they choose to treat pain. So you're absolutely right that there is some re-education of the provider workforce to make them aware of exactly the ability to help treat patients in what we would say a non-opioid manner, or at least in utilizing fewer opioids by increasing utilization of other approaches.
Now, are you doing this primarily through education or through legislation, or a little bit of both?
So it's a little bit of both. Our primary goal at Voices is to advance federal policy solutions to addressing and preventing opioid addiction. And so our primary lens through which we work is always advocacy. And so our primary audience is members of Congress, their staff, policymakers at the Centers for Medicare and Medicaid Services, and others. And so our primary lens through which we attempt to influence is through that advocacy sphere, but there is, as you note, some education that needs to happen of not just providers, but also patients, caregivers, and families who may have loved ones who are undergoing a surgical procedure, and they need to know what options might be available, what questions they can ask before they go under the knife, and things like that.
Final question, Chris. Where can people go to find out more information about this? Because it sounds very interesting. I think for people who are going to be patients in a situation, and we have an aging generation in this country, where can they go to find out more about some of these non-opioid possibilities?
Yeah, I appreciate the question. So our website is www.non-opioidchoices.org, and on that we have a resources page that has a wealth of information about some of these studies that talk about the ability to limit unnecessary levels of exposure, as well as some clinical resources about what non-opioid options might exist. So I would encourage folks who are interested in learning more or even getting involved to visit our website at www.non-opioidchoices.org.
Chris, lots of great insights this morning and good possibilities. We appreciate it. Hope we can talk again sometime soon.
I would like that. Thank you so much.
Thank you very much. Chris Fox with us on WSBA.